Have you ever heard a condition when the arm becomes so desperate that it literally steals blood from the brain? This is subclavian steal syndrome. The subclavian steal syndrome occurs when the subclavian artery becomes significantly narrowed before the origin of vertebral artery. This leaves the arm starved of blood. To rescue the compromised arm, the body redirects blood meant for the brain and send it into the arm. This reversal creates a steal from the vertebro-basilar circulation, leaving the brain undersupplied. To solve the mystery of steal, let's first explore the anatomical connection between the blood supply of arm and brain. The upper arm is supplied by subclavian artery, which is a branch of arch of aorta on the left side and a branch of brachiocephalic artery on the right. While the vertebral artery, the first branch of subclavian artery, climbs upward to supply the back portion of the brain, especially brainstem and the cerebellum. The vertebral arteries of both sides join to form basilar artery and together create a vertebro-basilar system. Under normal circumstances, these two vessels coexist in perfect harmony. Harmony breaks when a narrowing or stenosis develops in the subclavian artery. As the stenosis progresses, resistance rises and pressure distal to stenosis falls. Blood flow to the arm becomes compromised and the tissue begins to starve. The body responds by rerouting blood flow. Now the blood from the opposite vertebral artery flows across the basilar artery and then flows down to the affected vertebral artery and finally goes into the arm. This creates a retrograde flow pattern. Blood meant for the brain now flows backward straight into the compromised arm. The villain behind the steal have many faces. Most common is atherosclerosis, silently narrowing the artery over the years. Sometimes it results from inflammation in vessels, as in Takaisu arthritis, or from cervical rib striking early in life. The tight corridors of thoracic outlet syndrome may compress the vessel from outside. Previous radiation, surgery, or even the congenital anomalies may also play a role. Different triggers, but the end result is the same. Subclavian stenosis is present in nearly 30% of patients with peripheral arterial disease. In more than 75% of cases, the left side is affected. It is more common in men and risk increases after the age of 60. Many patients remain completely asymptomatic, but when the body can't compensate, the symptoms appear. The affected arms go tired, numb, or painful, especially in the motion or elevation. In severe cases, ulceration or gangrene can occur due to compromised blood flow. When the blood flow reduces in the brain signals its distress by dizziness, blurred vision, ataxia, vertigo, pre-syncope, and full syncope. This patient elevates and exerts the arm and suddenly his word tilts. Diagnosis begins with suspicion, arm fatigue during activity and dizziness, unequal arm pressure, blood pressure lower in the affected arm, and if the difference is more than 15 millimeter of mercury, it whispers, something is wrong. A soft bruit in subclavian fossa may be the next clue, but the final confirmation comes from the imaging. Color Doppler ultrasound reveals the reverse flow. CT angiography and magnetic resonance angiography show the degree of stenosis. The treatment starts with lifestyle changes, managing the risk factor of atherosclerosis, controlling diabetes, blood pressure, cholesterol, and avoiding smoking, alcohol, and stress. If symptoms persist, angioplasty or stent placement is often chosen. A balloon expands the narrowed segment and a stent holds it open, restoring forward blood flow. In complex cases, surgeons create an alternate pathway for blood to reach the arm. It may be carotid subclavian bypass, where the subclavian artery is connected to the carotid artery, or an axillo-axillary bypass, where the compromised axillary artery receives blood from the opposite side. These bypasses restore natural forward flow, spare the vertebral artery, and relieve the brain from the burden of steel. In simple words, the arm robs the brain only when it truly needs the blood.